Hello, my name's Stephen.
Hi, my name is Saboohi.
We're here to talk about the difficulties of talking to my GP.
So these are the difficulties that you have accessing your GP service?
That is right, yes.
Great, okay. So Stephen, I'd like to explore how you make the appointment when you need to see your GP.
I don't have to get Mum to make the appointment for me
Oh, why is that?
because I don't quite understand what the reception is saying.
Why is she speaking fast or?
Yeah, she does. She speaks quite fast and that. Yeah.
Okay, and what else makes it difficult for you to understand the receptionist on the phone? Does she use easy words
She
or
doesn't. She use jargon words and definitely
hard words,
hard
difficult
jargon
to
words.
understand?
Yeah, difficult to understand.
Okay. So, do you live with your mum?
I don't know.
So you wake up, you know you need to see the GP, and before you call the GP, because that's so difficult, you call your mum to make the appointment for you.
Yeah.
What if your mum's not available?
I have to call my support staff.
Right, okay. And why don't you ask your support staff before you ask your mum?
Because they always say now, I haven't got time with support staff.
Okay. Right, so you always call your mum first to make the appointment for you.
Yeah.
Okay. Do you know that you can book appointments online? Some surgeries let you do that.
I didn't know that, no.
Okay. If your surgery has an online booking service, do you think you would use it?
Depends if it's accessible or not.
Right, okay.
Well, more likely it isn't.
More likely, yes. They can be quite difficult. And have you got access to a computer at home?
I have, yeah.
Okay. So we're going to explore a little bit about what happens when you go to the surgery. What happens when you go to reception?
When I go to reception, say to them I'm here for an appointment.
Okay. And then you sit down and wait for your name?
Wait for my name to be called and that, yeah.
Okay. And do you have any problems with that?
Well, yeah, because if I can't read anyway, there's no audio on the thing, it's only visual on the screen.
Oh, I see. Your name comes up on a screen.
It does, yes.
Right. So they don't call your name. There's no speaker system or audio system.
There's no speaker system, no.
Right. Okay. And are you able to recognise your name when it comes on the screen?
Sometimes I can't.
Sometimes you miss it.
Yeah.
Okay.
Because it comes up too quick.
Right. Okay. And I imagine it's not very helpful when there are people that aren't able to read and you don't have the audio. Okay. And what about seeing the doctor?
Well, seeing the doctor, I have to take my mum in with me for that.
Oh, your mum comes to the appointment with you?
She does, yes.
Why is that?
Because I can't understand what the doctor's saying. So.
Does the doctor speak in medical terms?
He does speak in quite a lot of medical terms, yeah.
Right, and does he use long, hard words?
He does.
Right, okay. So what happens if you want to speak to the doctor about something that's private or confidential?
Well, don't know really. That's
I find it a bit
difficult, yeah, sort of thing, yeah.
And you still need to take your mum in with you?
Yeah.
That must be really hard, Stephen.
Yeah.
And how does that make you feel that you can't have a private appointment with your own GP?
Well, it makes me feel a bit, probably I should say slightly frustrated maybe in a way.
Yeah. So Stephen, I'd like to explore that a little bit more with you, why you feel the need to take your mum with you. What is it that the doctor does that you find so difficult? I understand that he uses jargon and difficult words.
It does. Definitely.
Do you ask the doctor to explain it?
I do, yeah.
Okay, but you still don't understand?
No, because it still uses medical terms on it.
Right, okay. Does he use any pictures or anything like that?
He definitely does not use any pictures or...
Right. if your doctor took the time to use easy words, maybe some pictures, maybe show you some things,
Oh, yeah.
do you think that you would be able to go to the GP without your mum?
I probably could, yeah.
Probably you could explore that.
Yeah.
So the jargon and the medical terms that the doctor uses is a real problem for you, isn't it? And it's a problem for lots of people you know. You have a friend who had a really good example of jargon.
Oh, yes, it was, yes.
Can you tell us about that?
Okay. Well, my friend told me that she having her cataracts done.
Right.
And I asked her, do you know what cataracts are? And she didn't know what they were.
So she came to you and said she's having a cataract operation.
Oh, yeah.
So she knew the term cataract, but she had no idea
What it actually meant. Yeah.
What it actually meant. She didn't know that she was going to have an operation on her eye.
Yeah, that's what she didn't know. No.
Right. Gosh, that's quite shocking, isn't it?
And I did ask her if somebody explained it to her. She said no.
She didn't know that she was...
She said nobody explained it to her, no.
Gosh. So it's more important to explain to somebody what's going to happen, which part of the body they're going to have treatment on, than the medical terms, which mean nothing. Okay.
Yeah.
And what about your prescription?
Okay, well, that's quite a jargon in itself anyway.
So that term is quite difficult to understand.
It is, yeah, very difficult.
Okay, so what about the medicine that the doctor gives you?
Okay.
Does the doctor explain how you need to take the medicine, or what the medicine is, what he's prescribing to you?
It doesn't explain it properly, no.
So how do you find out what medicine to take, when to take it, how much to take?
Well, normally the pharmacies, luckily I've got a good pharmacy and he sort of explains it to me.
What makes your pharmacist so good?
Really like, so he communicates with the people that go in there and all that lot. So,
Right,
yeah.
so he explains it.
Explains it to people, yeah.
And does he explain it in a way that helps you to understand?
He does, yeah.
Right. Using easy words?
He does, yes.
Okay. And does he check that you've understood?
He does check, yeah.
Right, okay. So, Stephen, you have some top tips that you'd like to share with us today about what medical professionals could do to make it easier for people with learning disabilities to access health services. Can you share some of those with us?
Okay, then. Well, they can, first of all, get easy read letters when they send appointment letters.
Right, okay.
That should be much easier. Anyway.
And can you explain what easy read is?
Well, not putting medical terms in the letters and that.
Okay, and easy read, does it have pictures, easy read?
Yeah, easy will definitely have pictures and easy accessible words.
Right, so usually a picture on the left, some easy words to go with that picture.
Yeah.
Okay. What else could they do to make it easier for you to access the GP?
Could explain what the medication's for and that sort of thing.
Right, spend the time explaining things. Yeah.
And maybe a double appointment would be a good one as well.
So you have extra time to...
Yeah, normally I only get 10 minutes anyway.
Yes, and that can be quite difficult, can't it?
It can
explaining and understanding. How can the doctor help you to understand things?
He can ask me if he's made it clear or not or something.
Right, so check that you've understood. And what about writing things down?
He could write it down, and easy read.
Right, definitely. And actually there are lots of resources available online. I mean, if we just take one of these that you shared with us, which was how to brush your teeth correctly.
Yeah, that's about dentists.
Yeah, and this was available online, simply showing how to brush your teeth carefully and what you need to do, the steps. So some information like this would make it easier to understand.
That would, definitely, yeah.
You've also got a jargon buster here that you developed.
Certainly did.
So you developed this communication do's and don'ts. In here, you've mentioned things like talking about one idea at a time,
Did you?
breaking big ideas down into smaller ones.
Okay.
But you also developed this jargon buster on the back.
Yes. I'd have a bit of help with that.
Yes.
That was
So could you pick out some of these words and explain? So for example, this one here, chronic. Lots of doctors will use the word chronic.
Yeah.
What could they say instead of using the word chronic?
Well, instead of using the word chronic, they could say it's a long-term illness, isn't it?
Okay.
And explain what the illness is. Sort of,
Right. Okay. And what about dressing? If you've hurt yourself, they often talk about putting a dressing on it.
Just saying they can easily just say they're just putting a bandage or a plaster on or something.
Okay.
Yeah.
And what about inpatient and outpatient? How could that be explained in an easy way? In this jargon buster, you've put that an inpatient is a person staying in hospital.
Mm-hmm.
And an outpatient?
Is a person just going for a quick appointment, so we can.
Right. Okay. So it can be done.
Yeah. Yeah.
Okay. Do you know that under the Disability Discrimination Act, you're entitled to ask for your doctor to make all of these reasonable adjustments,
Yeah.
to provide easy read, to provide a double appointment? Did you know that?
No, I didn't know that. No.
You didn't know
I didn't
that.
know.
And do you think that now you do, that's something that you could ask your GP to provide to make it easier for you to access the GP service?
I could probably ask him. Yeah.
Great. Thank you very much for sharing your experience with us, Stephen.
That's okay.